There it goes.
Okay, back to budget adjustment. So you're ready. We just decrease on the other amount.
Somebody's got something. It's me, and I'm trying to turn it off.
It's your dog.
I'll just leave and then figure it out. Yeah.
Yeah. Okay, Commissioner, you can introduce yourself for the record and your presentation. Yeah.
Okay. Hi, I'm Dr. Jill Bowen. I am the commissioner for Dale. And just a few front statements about the BAA. Dale is the Department of Disability, Aging, and Independent Living. The mission to make Vermont the best state in the nation in which to grow old and live with a disability with dignity, respect, and independence. Just a quick reminder that there are 5 divisions within the department. The Division for the Blind, Visually Impaired, the Adult Services Division, which focuses on older Vermonters, Developmental Disability Services, Division for Licensing and Protection, and Higher Ability. To go to the numbers, the Dale overview for BAA is $30,313,848. That includes the Internal Service Fund increase for the Agency of Digital Services at $312,378. The ACME collective bargaining agreement bonus for the direct care workers, all appropriations together is $2,396,001, and that is made up from the Adult Services Division at $161,483, the Developmental Disabilities Services Division at $1,188,481, the Traumatic Brain Injury Program at $4,711, and at the Choices for Care, $1,041,326. So together, that's the APS collective bargaining.
Why does this up like coming up from the Budget Adjustment Act and not in the regular budget pipeline? And who are these workers?
These are direct care workers that are not connected to an agency. They're the IRS paid that are connected to families or that they're the self-hire. You want to explain why it's a BAA?
Because you actually asked that question last year. So it's a 2-year agreement. So 1 year it's in the base, and then the next year it's in BA.
Okay.
We're on the 2nd year.
Okay. All right.
Yeah, that's together. So for Choices for Care, we have estimated nursing home pressures through the EFR, the Emergency Financial Relief, at $14.5 million. Choices for Care utilization pressure at $2.5 million. Choices for Care nursing home Medicaid day pressures, which is an AHS net neutral. We can explain that at $9,642,000. And Choices for Care, the Vermont Veterans Home Cost Settlement, our portion. There was most of it already in the base budget. The difference that wasn't is $963,267.
Now, why does it go all the way back to 24?
The state fiscal year costs, so the cost settlement to the state fiscal year 24 costs of 4.8. Do you want to explain why that goes back to 24?
Sure. So Division of Rate Setting collects their cost reports. And so by the time they get all the cost reports and summarize the state fiscal year basis, this is the timing of that cost settlement.
Well, we also are always think about when we do this with the veterans home, it's always a couple of years behind.
Correct. Year.
I knew we did it, but I didn't remember it being that far.
Nearly $4 million of that was already in the base budget. So the difference is the 960.
And on the emergency financial relief, we talked a little bit about this with Commissioner Gresham, and we pointed out at Center Westman that at least it's a lower number, but I think I hear a lot of concern about it. I don't know if there's any words of encouragement you want to say about why we shouldn't be concerned about continuing EFRs every year.
So what we should be concerned about is the instability of our nursing home system as a whole. And we should be quite concerned about that given the growing demographic. We are embarking on a planning year this year as we deep dive into the projections to truly understand what is it that we're going to need between now and 10 years going forward. And it's not just the nursing homes, the whole long-term care continuum, residential care homes, assisted living facilities, adult family care, et cetera, the whole continuum. But nursing homes right now are shaky. And that is to a large degree, there's several factors, all part of what we are looking very closely at. But the biggest one is still the workforce. And the percentage of our workforce that continues to be travelers or contract staff, which is very costly, is higher by far than the national average, which has come down quite a bit. So nationally, it's about 5% of the nursing home workforce that is traveler contract staff, not permanent staff. In Vermont, it's now about 25%. And it came down from 30%. So if you're looking for hope, it's glimmer.
Right.
That's the down for the emergency aid from 20 to 25 million that has been in the last 5 years.
You're talking about for the
You had
EFR.
emergency aid in the budget as a line item in the budget adjustment. 5 years?
So I can tell you what the BAA asks were over the past 5 years. So in 22, it was 0. In 23, it was 9.3 million. In 24, it was 17 million. In 25, it was 21 million.
Yeah.
And this year it's 14.5 million.
Yeah.
So the ask is definitely lower than it was last year. It's even a little bit lower than it was 2 years ago. So there is that glimmer of hope, but we have a significant, to get to even be awarded an EFR, the forensic financial analysis that's done is very involved, and Viva does that rate setting. And you have to be at risk for closure. Every bed or any bed that we lose in the system right now is really moving in the wrong direction.
And do we ever get new beds, or we're only preventing beds from going away?
So did you want to say something?
Well, let
Well,
me answer that,
Okay.
but in.
Okay. So we need to hold on to every bed that we have, and we need to add some. We do on occasion add some beds, increase some beds. We did, Mission Care was a big expansion and a focus on complex care, which is another of our factors that we're concerned about in terms of stability, which is the capacity for the nursing home to serve that complex population. Because there are some beds right now that are empty that can't be used because that nursing home doesn't have the skill or the equipment or the ability to. The other issue we have is that we don't have people lining up to purchase or build nursing homes in Vermont for innumerable reasons that you're probably aware of, right? There's housing issues, affordability issues. And so when a facility closes, it's hard to find an owner. And we've had several ownership transfers recently, and that has its own challenges.
Right.
So there's a number of reasons why we should be concerned about the stability of the nursing home system. EFRs notwithstanding.
So,
We did put money in this committee, and it was an initiative in this committee for recruitment of particularly nurses to try to help turn around the traveling nurse piece. Not knowing what will be in the budget of the governor, and knowing that you can't say anything, I would say to you that we'll be very interested in this committee, and particularly I will, around the issue of making sure that that money does not go away, and that we continue to help nursing homes address the issue of traveling nurses and see if there is in some way that we can help them recruit staff.
So,
Yes.
that initiative,
We were, I will say health and welfare was, very much behind that.
Right. We also have LPNs. So what is the level of nursing that we're looking for for nursing homes? So we need to really reinforce overall.
okay, so I'm gonna respond to a couple of different things.
Yeah,
Thank you
good.
for
Go
that
ahead.
question, and thank you for, the funding and everything for that. So the program that you funded was focused on LNAs. LNAs are the backbone of the nursing home system, which is a little bit different than what happens, let's say, in a hospital, right? There were 11 facilities in the first go round that received the grant in state fiscal year 25. And there were about 200 LNAs who were impacted by that. And the training and the mentoring and the recruitment and retention seems to have had an effect. It's hard to make a direct line, but going from the 30% to the 25%, we do think that this had some impact. This year, we don't have, this is just rolling for this year. We're in the midst of the roll, but 17 facilities have received grants in state fiscal year 26. And when we do the report in June, we will have the impact statement on that. And so the fact that the agency contracted staff has decreased by 5%, based on CMS data, is a good thing. One other thing I want to say about is you rate LPNs. So another project that Dale is working very closely with CMS on is the opportunity to use compensatory monetary penalty funds with some federal match funds to address nursing home workforce, particularly LPNs and RNs, with a focus on rural areas. So we have submitted for that. Our staff works very closely with CMS on this, and we are hopeful to have that roll out in addition to the focus that has been on the LNAs, also on the LPN and the RN. So we're very closely looking at workforce and continually working on how do we keep them. When I go to the nursing homes, I go and I talk to people who are traveling nurses or traveling LNAs, and I go and I talk to them and I try to get a sense. We're going to do this more formally. This is my informal, listening tours, but we're going to be doing this more formally by bringing different groupings in to talk about what the bigger plan for stabilization and sustainability is, our SNS plan, which if we consider that a 10-year go forward, is planning phase right now. So we will have different groupings in. If you saw the EFR report that DEVA prepared that was submitted in December, there's a number of initiatives that are projected there or proposed there. We need to do the engagement with the stakeholders, and so we're going to do that together with rate setting and DEVA, so that we can get the groupings in the room to look at the long-term care and see which of the proposals. Some of them have to do with the smaller nursing homes, which may need a different type of an adjustment to their rate because they have some of the same sort of administrative costs, but they get paid less because of the number of individuals they serve. Also, if you remember last time we talked about why we thought there would be a reduction in BAA, not an elimination, of EFR that we would be talking about right here. We are right now, was because the 2-year cycle of the nursing rebates was coming up. And so it's always rebased back to a previous year. And the last rebase was pandemic impacted, and so it didn't really match the reality. This rebase matches it, and most, not all, saw an improvement in their rates. But the report, if you haven't seen it yet and you're gonna read the EFR report, it also talked about, should there be more frequent rebasing? And should there be a rebasing alignment with the different parts? So there are indirect costs, there are medical directed costs, there are like residency costs, and there are nursing. And one gets recycled on a 4-year cycle, and one gets recycled on a 2-year cycle. So to really align it and shorten it so that you're as close as you can be reasonably to what's happening on the ground. Does that give you some hope and optimism?
Yes.
Well, I'm hoping, and I suspect that the Health and Welfare Committee will right here. We're hoping that, that as the budget comes forward, those initiatives that have been started will be continued.
Sweet.
So, our concern is not, just about EFR, it's a symptom of, a bigger concern. Yeah.
I'll be working on bigger.
Yeah, I love that.
Yeah.
So that's our report. Do you have
On
any other
the,
questions?
on the ADS service fund increases, I guess it's another question of why the time, I thought at the last budget, we front loaded the ADS increases so that we wouldn't have this. Did we try to fix that last year?
Did you wanna?
Right?
Yeah. For the record, Tracy O'Connell, AHS. This is those net neutral adjustments that were coming out of E300 to the departments.
Okay.
So they are just net neutral. We just didn't know what Dale's portion was going to be at the time we built the budget.
And then did the ADS charge you as a agency, not by department?
Correct.
So then you just have
Yes,
to equalize it.
our overall invoice is 13.8 million.
Right.
And we have to parse out by department.
Okay,
Mhm.
okay. I like your handout, like this 4-pager that just says very simple, because sometimes looking it up in the up and down sheets or the spreadsheet are difficult, and then you did a very good job of the way you laid it out. Thank you.
Props where they are deserved.
Yeah, yeah, no, it was very good.
It's actually easier for me too, and it all makes so much sense, so I
Yeah.
appreciate that.
Yeah, yeah, good job, though.
Thank you.
Okay, any other questions? All right,
Thank you so much.
thank you.
Yeah.
Okay, we succeeded.